Illinois Stories is brought to you by the Corporation for Public Broadcasting and by the support of viewers like you. Thank you.
Hello, welcome to Illinois Stories. I'm Mark McDonald in Quincy at Blessing Hospital, where they recently celebrated an anniversary. 30 years of providing hospice care. Now, a lot of people still don't know what hospice is. So, during this program, you'll get to meet some of the nurses that provide this care and a patient that receives it. Jerry Conboy, hospice care, November's Hospice Month.
That's right.
Blessing's been providing this service for 30 years.
That's correct. A little over 30 years,
A little over 30. I missed the anniversary. It was last year. But in all the times that people have been hearing about hospice, many of them still are not aware of what makes it different than other medical care. What does make it different?
I think part of what makes hospice different is the philosophy and the approach to care. Our focus is on comfort. It is on quality of life. It's helping people define quality of life for themselves. And so much of medical care focuses on cure and sometimes almost tunnel vision. What is the situation? What are the symptoms? What can we do to address this situation? Where hospice focuses on everything. It focuses on the patient's physical comfort. It focuses on their emotional, their spiritual comfort. We provide services and support to their families. Mm-hmm. We provide support after the patient has died to the remaining family. So we really look at the whole picture.
What makes a person eligible for hospice?
In order to receive hospice services, 2 physicians have to agree that a person's prognosis is 6 months or less life expectancy.
Oh, I see. Okay, so these people that have their eyes wide open, they know going in that they are not going to be cured of whatever this condition is. They are going to live with it for a short period of time, and then they're going to be as comfortable and get as much out of their days left as they can, and then they're going to die.
Absolutely. And I think, we all want to hope, and we certainly don't want to take somebody's hope away from them. So we don't spend our whole time, driving that point home that you have a terminal illness. What we spend our time doing is helping people live each day to the fullest.
Mm-hmm. Now, we mentioned that it's been more than 30 years since Blessing's been providing this. How has the care changed over those years?
Oh, dramatically. I've been with hospice for 25 plus years. Mm-hmm. So in that time, I've seen huge changes. When I first came to work with hospice, I came in the role of a social worker. And at that time, most of our patients had cancer. At that time, for anybody who had cancer, when they received that diagnosis, then most of the time they were determined terminally ill because there wasn't a lot of treatment options. Mm-hmm. There wasn't the array of medications, of chemotherapy, of radiation therapy, those kinds of things that are available now. Mm-hmm. So that's been a huge change. And then along with that, because there's more treatment options for cancer, we now see fewer patients that have that as their diagnosis. So actually, our hospice, and really across the whole country, less than half of our patients have a diagnosis of cancer. Mm-hmm. The other half have other diseases that sometimes start as chronic and move into the end stage of a disease. Mm-hmm. And those are typically respiratory diseases, cardiac diseases, and dementia. Mm-hmm.
Well, Jerry, during this program, we're going to get a chance to meet one of the patients up in Carthage that is living in assisted living, and she's receiving services from Blessing once a week. And her son is going to talk to us about making those decisions and how you make those end-of-life decisions.
Right.
And you also have a couple of really sharp RNs that help people through the process who we're going to talk to as well. So thank you for this and for making the people available to us.
Thank you for considering hospice a worthy subject.
Yeah, thanks. Orma, you found out some years ago that you had cancer.
Yes.
And you and your family had some very difficult decisions to make at that time. And like all cancer patients, you never know how the disease is going to progress, do you?
No, you don't.
Yeah.
They told me that at the time, but I didn't realize that that I could still be alive at this time.
Mm-hmm. And aren't you fortunate?
I am very fortunate. Yeah. Sometimes when one of my worst problems is I'm so tired all the time. Mm-hmm. I'm just dead tired all the time, and I don't go down for breakfast but I eat in my room. I have to keep going, and I know that I have to eat, or I'm about 80 pounds.
Yeah, you're already tiny. Yeah.
And I've lost quite a little bit of weight since I've been in here.
Even though you're eating fine, right?
And the food is wonderful. They just have great food. I don't find anybody that eats here, if they can't find anything on the table to eat, there's something wrong, because they have great food.
Yeah, you're living at Hickory Grove Apartments.
Right.
And it's an assisted living facility in Carthage.
Right.
And you have family close by, which is very nice. You have a
Yes.
son who lives in, I think, Quincy. I think
Right.
Quincy. But the decision really is to how do we manage this? How do we make the most of the days we have left when we don't even know how many days we have left? That's hard. It's hard, isn't it?
There are many times during the day that I think, oh, if I could just go now. I don't want to go. I'm not ready to go, but if I could just do it. But it is hard, very hard. Yeah. But I do find that if I wake up in the morning and find myself in that mood of thinking that, I think you got to get out of bed. You've got to get up and get to moving.
Yeah.
And that helps. And then after, of course, I don't have many good full nights sleep, but after I've slept, I try to get some food down me, and then I lay back and take another nap.
That's not so bad.
No, it isn't bad.
Now you have staff here at Hickory Grove, which help you, but you also have a hospice nurse that comes from Quincy.
Lynn.
Yeah.
Lynn. Oh, she's going to quit working full time. I don't know if you knew
You're
that.
going to miss her, huh?
Oh, yes. She is. She's just been wonderful.
What does she do for you?
She comes and, of course, she fills my medicine box, and gets my. I cough a lot, and she gets everything kind of straightened out for me. She just does a little bit of everything. She's a wonderful person.
Does she? I imagine there's some pain with your cancer. Does she help you manage that?
She helps me manage that. But I'm very lucky. I'm not in dire pain like a lot of people are with cancer. But I'm aware of it all the time.
Yeah. Did you know what hospice care was before you got into this condition?
No, I really didn't know. I had a friend that had a daughter that worked in hospice in McDonough County. And that was about all I knew about hospice. And when the doctor talked with, the doctor and the nurses talked with the kids, I knew they were impressed with it, and I knew I was. I mean, I knew that it was for me to look into, and I knew they were wanting me to, but they didn't tell me what to do. They let me make my decisions, and they were real good.
It looks like you made a good decision, because you have done so well.
I have. There are times when I think, could I have been diagnosed wrong? Or things like that, but they say not, so I have done very well.
Yeah.
But I have worked, if I felt bad, I tried to shrug it off, I guess I'd say.
Yeah, it's you have a very strong character and a strong will, and that helps a lot.
Well, I think it does. Yes, definitely.
Yeah.
Well, I didn't want to come here naturally from the start. I thought I was well taken care of in my home, and I was. But I realized after I came here that I wasn't being.
Yeah.
I had to do things that I really shouldn't be doing. Mm-hmm.
Orma, thank you for visiting with us, and best of luck, okay?
Thank you. You've been very nice. I am so fortunate they have such a wonderful staff here. They have been very nice to me. They tell me I've been nice to them, so
I'm sure that's true.
I hope I have been, but they have been very nice to me. So I am really happy to have had the opportunity to come here. Mm-hmm. And I never even had a thought of that I made a wrong decision at all. I've just been
very fortunate.
Very fortunate. Mm-hmm.
Thank you, Orma. Terry, your mother is absolutely charming, as you probably know.
Absolutely.
And she has a terrific attitude, which I assume helped a whole lot when your family was making decisions on how is Mom going to live out the rest of her days with this cancer. Mm-hmm. And her attitude had a lot to do with it.
Absolutely. She, through this whole process, has been mentally alert, strong, pretty much pain-free, so that's made it easier for everybody to make the decisions we make as we move along. We shopped around together for trying to decide whether she stay home, go into assisted living, whatever, and then as hospice became an option for us, it became a very easy decision to move that way, and we're very happy with that.
Hospice now is from Quincy, from Blessing, is about 30 years old. They've been providing the service for 30 years, and I assume they've gotten better and better and better at it. And you've been pleased with the way things have gone and the care she's gotten that way.
Absolutely. The staff, hospice staff, does an excellent job of communicating with family. The nurse that my mother works with communicates regularly. I get a phone call every Friday morning and say, what can we do? Do you need anything for the weekend? And thank goodness we haven't needed much. But social worker, the ministerial staff, I've just been very impressed with the whole operation.
Yeah. There was a time when Orma and you and your sister had to make a decision. I'm sure she wanted to stay at home because almost everybody does. But that wasn't going to work, was it?
No, because she had been in and out of the hospital several times for whatever reason as she was living by herself. And because of having to deal with the hospital and so forth, moving into assisted living and transitioning with hospice, actually it became a pretty easy decision. We didn't struggle with it at all. And a lot of that's due to her attitude.
And then when it unfolds that this assisted living facility and the hospice can team up and make it successful, it makes you feel pretty good, doesn't it?
Yeah, absolutely. Carthage is fortunate to have this facility, and my mother's fortunate to be here, and they do team up well. They communicate well. They communicate with the family well, both sides, and it's a very comfortable situation.
Well, good. And thanks for visiting with us. Appreciate it.
You're welcome.
Ashley, we just visited with a woman named Orma, who's a cancer patient, and she's receiving hospice care. in an assisted living facility.
Sure.
And so it's interesting to talk to you because you've been an oncology nurse and you're a nurse practitioner, and some of the patients you see are hospice patients.
Right.
And this whole hospice movement, which unfolded, here at Blessing about 30 years ago, has really, it's really developed, hasn't
Sure.
it?
Oh, yeah.
To the point where I guess there are a lot of people who are in a position where they need some kind of, to be tracked and supported in a way, and that's what you do, isn't it?
Right.
Yeah.
Yeah.
How does that fit into the overall health picture for somebody like a Orma, for instance, who she doesn't know how long she has to live?
Sure. What I find is that the patients just need somebody to support them and to have access to someone that knows what they're facing. Death can be a scary thing.
Oh, yeah.
And until you're faced with it, you don't understand what that really means. And so for somebody like Orma to have that support and to have nurses and a physician or a nurse practitioner at their fingertips to make sure that their pain is managed, to make sure that all their medications are taken care of, and to take that fear out of it for them is significant. And to have somebody there that knows what they're going to go through and be able to explain things to them.
I'll bet that's part of it. I'll bet that's one of the most scary parts is that just not knowing how long you have to live. None of us know that.
Sure.
But the sort of not being in touch with what's going on.
Right.
Somebody has to let you know what's going on.
Right. Right. And the nurses and the physicians and the nurse practitioners are the ones who have seen it through other patients and can kind of ease their anxiety and be that support system for them. And something that none of us never know what death really is. And it's easy for each of us to say, yes, someday we're going to die. But until you're faced with it, you just don't understand.
Yeah.
And so that really helps, I think, patients, especially patients, like Orma, that the unknown, the fear of the unknown.
Yeah. And then there is, of course, the nuts and bolts of managing a person's condition and pain.
Sure.
And particularly in a cancer patient's instance, managing pain is something that you would be an expert at, and somebody that they would really rely on, because, how much does it hurt on a scale from 1 to 10? How much does this hurt? Well, some people are going to say 5, some people are going to say 8. It's the same amount of pain, and you sort of have to get in there and learn them, don't you?
Yes. Definitely have to figure out. And you have to know each patient's threshold of pain is so different. And some of that comes from experience of pain. Some people have never experienced pain, and so a small amount of pain is significant to them. And you have to know where the patient wants to be with their pain. And also, when you're dealing with hospice patients and pain control, you also have to know, are they okay with a little pain but still being coherent, or do they just want to be out of pain no matter what it takes pain medication wise?
Yeah.
Also, patients respond differently to pain meds. So, you can't always just go down a system and say, check mark all these different types of pain meds and give them to each person. Everybody's different.
Yeah, and when you leave a patient, and I'll bet this is true with you, when you leave a patient, you leave wondering, probably the rest of the day or the next day, you're thinking, I hope she's okay, and I hope that was right.
Yes.
I need to check on that again,
And typically that's what I do is I call back, I deal with a lot of the nursing home residents who are on hospice, and that's what I do. If I've changed something, I call back, either that evening, sometimes that evening, depending on the situation, or the next day, or within a couple days, and just say, how is that patient doing? Do we need to do something different? Because sometimes the patients don't always say. They don't want to burden somebody. They feel like they're going to bother you. And I think reassuring them that they're not a bother, and that's what you're here for, and that's what you love to do, is to take care of people. And so I think that's key, to check up on them and to kind of bring that back. In my situation, dealing with nurses in the nursing home, bring it back to their mind. And they may have got lost in the shuffle of their day and forgot to call me and let me know. So
and in your specialty, it's unfortunate, but you lose a lot of patients just by the nature of what you do.
Sure.
And I'll bet that you feel that loss. I'll bet.
Yes. Yeah. Patients become more than a patient to you, and sometimes that can be tough. But you just have to be able to care without taking it, into your own personal life and letting it affect you like it would a family member. But yeah, they become more than a patient.
And then there's that other situation where, let's say, and I'm sure this has happened to you on numerous occasions too, where you have a patient and you have some kind of a traumatic situation or a sudden turnaround where they need immediate care. You can't just allow them to go through their normal cycle of dying when that occurs. And then you have this jarring situation happen, and you have to help them through that as well.
Right. That's typically what it ends up being, is there's some significant change in a patient, and then we have to assess it, identify, is it something fixable, or is it a part of the process? Is it some other disease underlying it? And what's the patient's goal? What's the family's goal? Is it something that we want to proceed with fixing, or is it something we want to just leave be?
Well, thank you so much for what you do for them, but for talking to us too.
Yeah, you're welcome.
Thank you.
You're welcome.
Stacy, you're an RN, and principally what you do with the hospice program is you do intake. And we're going to talk about what intake is a little later on, but what I find most interesting about you is the way you came to become a hospice nurse. You weren't an RN at all when you had your first baby. And what you experienced with your first baby, Cooper, led you on a very interesting journey, didn't it?
Well, it was actually, he was my second.
He was your second?
Yes, Cooper was my second pregnancy.
Okay.
We had Jude, and when Jude was about 17 months, we delivered Cooper, little boy. When he was born, we quickly discovered that he had a rare genetic disorder, and that disorder has a life expectancy of less than 6 months. Yeah, so we had, lucky for us, we had a wonderful pediatrician who, gave us the opportunity to take him home and just love on him and treat him like he was a normal child. With Cooper's illness, he couldn't see, he couldn't hear, he had an NG tube for feedings because he couldn't suck on a bottle, couldn't move, the seizures. He had a lot of different health issues with his disease. So, once that doctor told us, you can take him home and just love on him, the words out of our pediatrician's mouth were, if you want to go to Walmart, take him to Walmart. Just take him out, gussy him up, and just live normal. So that's what we chose to do.
And so that actually, you became the recipient of hospice care then, because somebody had to visit you and make sure that everything was stable.
Yes, yes. When we were released from the hospital, there were 2 nurses waiting for us at home, and they had all the equipment set up that we would need, which is overwhelming at the time, but they went through everything, step by step on that first initial visit, just to make sure that that we had what we need and Cooper had what he needed.
And then they stayed with you through the entire 2.5-month period?
Yes, yeah, because he passed away when he was 2.5 months old, so that entire time we had nurse visits, we had social worker visits that really helped out with our son Jude, who is now 10, but at the time he was under 2, so he required a lot of extra attention as well. So the social worker would come out and visit with him, and we had a chaplain, and just a lot of the extra support.
It made a real impression on you, didn't it?
It did.
What did it cause you to do?
Probably about a year after Cooper died, I decided that with no schooling really at all, I was going to go back and become an RN, that I wanted to work with hospice. So it took me almost maybe 3 years to get through the whole program. And while I was in nursing school, I did my internship with Blessing Hospice. And of course, at that time, I already knew that that's what I wanted, but it gave me further insight into the job. So once I actually had my RN, then I worked at another hospital for about 6 months when hospice called and said, "Hey, we've got this opening.
You'd be interested in.
We've got this opening in admissions." Yes, I'm pretty sure I put my 2-week notice in right away, not knowing if I had the job or not at Blessing, but they knew that it was in my heart. I'm very passionate about it. Hospice is such a wonderful, wonderful program, especially for everybody knows that you're going to die sometime, but not everybody knows, that it's may be in 6 months or less, or than it might be tomorrow. You know, so it was really nice to have the support, and I knew I wanted to give back in that way.
So now when somebody comes in asking or looking for hospice care, you're the first person they see?
Yes, I am the admission nurse, one of the admission nurses. So my role is to meet with families, explain the program, you know, let them know what we can offer them if they choose, you know, to have the extra support. So I meet with the families, explain it, we can do paperwork, answer any questions that they have. And you know, you never really know the situation of a patient and their family dynamics. So when you have that chance, being the first face that they see, you know, I feel like, you know, they can open up, put everything kind of out there, ask me anything, and, you know, with my past experience, I can use that to help them. So.
Well, that's terrific. You found your calling. That's what everybody wants to do.
I did. And I'm very passionate about it. It is one of the top passions that, you know, when it's humbling, I guess I should say. It's humbling. You know, it's somebody lets you into their home and they don't know who you are. And here I come walking in this room and talking to you about dying and death and being comfortable and not going back and forth to the hospital for life-sustaining or, you know, life-prolonging treatments. And yet they let me, and it's humbling. So I've met some wonderful, wonderful people. So
thank you.
Yes, thank you.
Abraham Lincoln once said something to the effect that it's not the years in your life that matter, it's the life in your years. That certainly is the philosophy behind hospice. With another Illinois Story in Quincy, I'm Mark McDonald. Thanks for watching.
Illinois Stories is brought to you by the Corporation for Public Broadcasting and by the support of viewers like you. Thank you. For a DVD copy of the program you've just seen, send $19.95 to Network Knowledge, P.O. Box 6248, Springfield, Illinois 62708. Be sure to include the program name, subject, and when the program aired. You can also order with your credit card by calling 800-232-3605.